Venous insufficiency. Venous insufficiency is a result of prolonged venous hypertension that stretches veins and damages valves. It can be seen in obesity because obesity can chronically distend veins and lead to damage of the valves. You also can see it in patients or people who sit or stand in one position for long periods of time, such as teachers or office workers. So, what are some of the ways that we can prevent venous insufficiency? Again, it's monitoring that blood pressure and keeping it under control. Also, wearing graduated compression stockings, making sure that they're not too tight, but making sure that they are a firm enough fit. You want to make sure that you're elevating your legs at least 20 minutes 4 or 5 times a day. Try to avoid prolonged sitting or standing. And again, not crossing your legs. And again here, and I'm reading on the venous insufficiency patient and family education on page 727. It talks about not wearing restrictive pants or avoid garters and girdles. But also, one of the things I want to make sure that you're aware is if people have edema to their lower extremities, a simple pair of socks can cause that restriction, just as a garter could or a girdle could. If the sock is too tight, it is acting like it's acting just the same way that girdle or garter would, causing restriction to the venous flow. The goal with all the education it talks about on page 727, patient and family education, is to decrease edema and promote venous return. What can happen if the patient is unable to manage their blood pressure or do not manage their blood pressure and do not start to wear their compression stockings? What are some of the things that can happen with venous insufficiency? Well, over prolonged time with venous insufficiency, you can end up with venous leg ulcers. Venous leg ulcers are a major cause of pain, death, and healthcare cost. Most venous care ulcers is delivered in the community setting. As you can see here, this patient has insufficiency. You see the darkening of the legs, that brownish color to the legs is indicative of venous insufficiency. And note the venous ulcers. These ulcers from venous insufficiency are very hard to heal. A lot of times when a patient has chronic venous insufficiency and has developed ulcers, it will require the care of a ostomy nurse or a wound and ostomy nurse, a WOCN, to help to navigate the care of this patient with this ulcer. Venous stasis ulcers are slightly more manageable than ulcers from arterial disease, but they are usually chronic in nature. Patients who have venous stasis ulcers will generally have them for life, or they will have them for several years. Anytime a patient has venous stasis ulcers or venous insufficiency, they should plan to wear graduated compression stockings for the rest of their life to prevent these ulcers or to prevent new ones from forming. The difference between the oxygen permeable dressings, that's when you're looking at like a Tegaderm or what they call a polyurethane film over the dressing. An impermeable dressing would be more like a hypercolloid or a Duoderm type dressing over the wound. A lot of times if these patients are still ambulatory, they will use a Uniboot, which is wrapped. It's a gauze that is moistened with zinc oxide, and when it is wrapped on the leg, it hardens similar to a cast, and this promotes venous return and prevents stasis ulcers as well. The Uniboot should also provide a sterile environment for the ulcer to heal. So Uniboots are old, but are still used a great deal with our ambulatory patients who have venous insufficiency. Moving on to varicose veins. Varicose veins are distended, protruding veins that appear darkened and torcid. With that being said, what causes varicose veins? Well, you'll see varicose veins usually in adults older than the age of 30. They may be in a occupation with a lot of standing or heavy physical activity. You also again see it with heart disease, obesity, and also patients can have a family history of varicose veins, will put them at greater risk for varicose veins. So what are some things that we can do to improve or maintain optimal venous return to the heart and prevent progression of these veins? Well, we can wear our compression stockings when working for long hours. We can elevate our extremities, of course, exercise. There is sclerotherapy, which is where they will laser treat the veins themselves. There is stripping of the veins, which is a surgical procedure, and radiofrequency energy to heat the veins. But the big thing here that I want you to realize with these varicose veins is that what we want to be able to do with these veins is to make sure that we're preventing progression of the varicose veins, but mainly optimal venous return to the heart. So again, compression stockings, compression stockings, compression stockings. Have I said the word compression stockings yet? Okay, now a specific type of varicose vein is a hemorrhoid. What is a hemorrhoid? It is a swollen or distended vein in the anterior rectal region. They can be internal or external, and they can be very common, and they're not usually significant unless they become painful. How can we prevent hemorrhoids? Very similar to a lot of the other things we've said today. Ideal weight, avoiding constipation, avoid straining when you're having a bowel movement, and again, daily exercise. All of these things will help to prevent hemorrhoids. So what are some nursing interventions we can do for a patient who has hemorrhoids? A lot of conservative measures can be used to reduce pain. Cold packs, tepid sitz baths, a cane ointment to help to numb the area. If itching or inflammation are present, they may use a steroid cream. If hemorrhoids are severe and bleeding and causing a lot of pain, the patient may have a hemorrhoidectomy. With a hemorrhoidectomy, one of the main things you want to, even though a lot of times this is an outpatient procedure, so on your discharge teaching, you want to make sure that the patient is aware that the first bowel movement may be very painful, and to make sure that someone is close by in case they need assistance or feel as though they're going to pass out. So you also want to make sure that the patient going home after a hemorrhoidectomy is placed on a stool softener. Notice I said stool softener, not laxative. We just want to soften the stool, not cause cramping. So we're looking at something like a deluxe slate, something like that, not something that is a laxative. We're looking just at a stool softener status post hemorrhoidectomy surgery.